NADG. Welcome to this week's NADG Insights message. Today we're going to provide a link for everybody, and like last week, we're continuing to talk about the vaccine, trying to get as much information to the group as possible so that you can make an informed decision. North American Dental Group, our PDA, our doctors, we've done a lot of homework. We have a committee focused on it. We want to continue to bring everybody as much information as possible, and we really highly encourage everybody to consider getting the vaccine. We've repurposed a lot of the resources at our PSC and otherwise to call regional health centers, etc., to create information and access to where each of our team members can go that are patient-facing so that they can receive the vaccine. So, a number of our regions, team members, a lot of individuals have received the vaccine. And this week we're providing a link to an interview. Dentistry Today was kind enough to showcase us on an interview and helping to talk about what we are doing in the company and our thoughts and opinions on dentists being able to able to serve in the public health effort to get the vaccine out to our patients, to our communities.
The COVID-19 vaccine is starting to roll out, but there are concerns that it isn't reaching people quickly enough. Many dentists have said that they're perfectly capable of administering these shots, and they're ready to join the fight. Regulations vary state by state, but the CDC is issuing guidelines to help these dentists get involved. The North American Dental Group, a dental service organization supporting more than 230 practices in 15 states, is following these developments closely. Today we're speaking with Dr. Andrew Matta, the group's founding partner and chief medical officer, about how dentists can be part of these vaccination efforts. Dr. Matta, thank you for joining us today.
Yeah, thank you. Appreciate you guys having us.
Okay, great. Well, first of all, can you provide an update on the overall state of the vaccination rollout in the nation?
Yeah, absolutely. First, I would just say it really is exciting, actually, that we have a vaccine. I think it's kind of a bit of a miracle to see how fast medicine was able to work together and the pharmaceuticals to be able to, in 2020, actually start disseminating a vaccine and have it approved. Expediting that was really impressive. In terms of disseminating, we do have 2 approved in the United States vaccinations. Of course, the Pfizer vaccine, the Moderna vaccine has been approved for emergency use. And then we have a couple that seem to be on the horizon. Johnson & Johnson seems to be, very close as well. And I do know that England and the United Kingdom have started to use the Oxford vaccine. So the state of the vaccine is there's options, more to come. And now it's just a matter of how do we get this to the 300+ million individuals in the United States that need this vaccine. How do we create awareness? How do we make sure that individuals understand it's safe? And just more than anything, how do we actually facilitate administering it as rapidly, efficiently as possible?
Okay, and dentists certainly have expressed an interest in joining that fight. Now, what qualifies dental professionals to administer a vaccine?
Yeah, the dentists are going to be a great avenue for dissemination of this vaccine. We see, 1,000 patients a year. Most average practices will see, multiple thousand unique heads annually and weekly, hundreds of individuals. So one, we're a good access point for our patients. 2, in terms of the qualifications, dentists are extremely competent and comfortable in terms of the pharmacology. We're educated in, the same initial classes as other medical professionals, physicians, in terms of pharmacology, anatomy, and all of the necessary chemical understanding for pharmacology. In terms of the actual procedure, if dentists are doing more injections than any other healthcare professional, and much more precise, specific injections. We're finding a nerve bundle in between, other veins and arteries, and we're kind of threading a needle in the gums in very precise locations. A muscle bundle in the shoulder is like, instead of the needle in the haystack, you're hitting the haystack as a whole. So the dentist is certainly competent and comfortable in terms of the actual procedure itself, most likely doing, again, more injections than any other profession. And then, as far as the science and understanding the complications that could occur and managing a patient through those, dentists are competent in that. I mean, we're comfortable navigating allergies, responses, medical emergencies that could occur. It's a very safe and effective place for patients to get this vaccination.
Okay, and what about additional training? Obviously, the medical training is there. As you said, you know the pharmacology, you know how to use a needle. But what about things like the logistics, handling the vaccine, making sure it's safely stored, considering some of the temperature considerations? What about those kinds of issues?
Yeah, and I'm actually personally going through those logistics and getting the understanding. Actually, today, I've positioned our office, my specific office. We've worked hard to be, a first mover in trying to make sure that we're, earlier on we were doing COVID testing. Now we've migrated. I've set up our office and applied for the appropriate lab permits, and now to the state to be a facility that can administer and have the vaccine distributed. So outside of Pittsburgh, Pennsylvania, I was talking with the state yesterday. They're moving forward with processing the office. So now we're going through those trainings. And it's just exactly like you said, it's logistics. You want to understand, what are the temperature controls you need to have set up? What kind of equipment do you need? It is very specific chemical nature for each vaccine's different. Pfizer, has a very sensitive chemical compound that needs to stay frozen through its distribution. And then, it can only be outside of that freezer for so many hours before it breaks down. Moderna has its own specific conditions. So it's just exactly that. It's getting the training, which is available. It goes from either, depending on the state, a couple hours to a little bit more thorough. And it's necessary. If dentists are going to do it, we should go through those logistical trainings and make sure that there's a vaccine coordinator on the team, that the whole team is kind of understanding what is happening, so that we can all speak educated and confidently about, going through and doing this. So yeah, that the logistics is something you want to be comfortable with and make sure that everybody on the team is prepared to facilitate it.
So you suggest it within a dental office, nominating someone to be, as you said, like a vaccine coordinator? Is that how you would characterize it?
That's how we set it up. We've set everything up. And again, this is about understanding. This is where dentistry is stepping into some things that might be less familiar to them.
Mm-hmm.
So it is about becoming familiar with the nuances of delivering vaccinations. In our team, we've assigned an individual, a vaccine coordinator. They're going to be the main point person in understanding how much inventory, watching things like the temperature controls of the refrigeration and the freezers, all of those, kind of becoming the team expert. The dentists themselves want to have more even logistical understanding, but sometimes as they're doing all of the patient care and different things, you want to have that team lead that becomes the expert within your office.
Okay, and as we said, regulations are going to vary state by state. So what role are the state regulators and the state dental societies going to have in a lot of this rollout?
Yeah, so right now it is going through the states. The states themselves are distributing and allocating where the vaccines are going. So, it goes from the state typically to a county, and then the county is then, allocating it to whether it's hospitals, and in our case, dental offices and some, pharmacies. So it's kind of that trickle down effect of how it's being pushed. But it is, being pushed through the state avenues. In terms of dentists themselves being an avenue to do this, that has a lot of variability state by state. So what we have seen, because we're sitting in 17 different states, you're getting a feel of the variety of different ways that things are happening.
Right.
Some have created emergency authorizations of dentists. That's what Governor Wolf did in the state of Pennsylvania, authorized certain healthcare professionals, be it that they've met logistical trainings and other, permits can be an avenue for dissemination. It's different state by state. So one thing I'll note is, as you kind of started with, the ability and the state of the union of this being distributed, there are some states that have done actually a really nice job of being prepared. We knew a vaccine was coming. We knew that it was imminent to be able to support this. It was the when that was the question mark. There were states, and one that I have to recognize is Connecticut, was sending information to us as dentists to set up our teams in terms of being able to receive the vaccination, to have safety among the team, and doing some things in November before this was even approved, pending the approval. So there's other states that have been more reactive. It's coming, and it seems like some are. I'm not looking to be political because it's not about that. It's just it is important that we're staying as nimble as possible and as agile so that this can get efficiently disseminated. But as it relates to dentists, it's different state by state, but many of them have authorized dentists to be an avenue here.
Okay, and North American Dental Group had a similar experience last year when you offered COVID-19 testing very early in the pandemic. What did you learn from that experience, and how is it preparing you for vaccine administration?
It's related to what we talked about already. What we learned was, one, that the dental practice is a great setting. It's a great access point. Our patients were really happy to hear that we were offering testing. So back in April, there was a lot of question marks as to where can you go and how do you know if somebody's safe or not? So testing is still, and even though the vaccination is out, testing is still a major component of fighting this pandemic. So what we learned is it is great to have that service available for the patients. And then we also learned that, we started to navigate those logistics that we talked about, that there are things that you need to put in place. There are things like CLIA certifications and permits that are new, but they're not necessarily complex. So those are the things that we learned on getting set up and kind of taking those steps to be able to offer services like testing and now vaccinations.
And as you just said, patient awareness is such a huge part of the equation. So even once dentists in their respective states are allowed to administer it, how could they best get the word out and say, hey, everyone, we're making it available. You can come see us instead of waiting online at a different center or their doctor's office or somewhere else?
That's creating ongoing communications, allowing your patients and really the entire community to know that we have this service is important. So just proactive communication. Now there's so many avenues that you can communicate with patients between, digital communications and social media, that we offer this service, and we're here to be a public service to the community as a whole. So it's the patients that you serve, but this really benefits when you're using it to help in this whole public health effort in general. So that there's awareness of, hey, here's a facility that I can get this done. I think there's going to be a real value for patients. The question relies, how long will you be immune if you get this vaccine?
Right.
My current focus is let's get ourselves set up to deliver the vaccine, but we're already forward looking to, okay, let's start to consider testing our patients. They're coming in every 6 months. We're already seeing them on a recall basis. Can we do an antibody test every 6 months to watch the immunity of individuals to COVID-19?
So you think that COVID-19 testing and possibly immunizations could be just a regular part of your 6-month recall, along with your x-rays and cleanings? You might be tested and given an injection as well.
And hopefully more than that. My vision is that the dental setting is a great access point for individuals to get their cleaning, have testing for hopefully other things outside of COVID-19, potentially other viruses like HPV or just the flu, be able to get the annual flu vaccination. So you're coming in, you're getting those services. And then really, the diagnostics. Our patients are going to the dentist more than any other health professional. So let's use that as an opportunity to collaborate with their primary care and receive certain diagnostics, and being able to share that into the primary care system so that they can stay attuned of what our patients have, going with their systemic health.
Right. We're seeing more and more research connecting oral health with overall systemic health. So this is just one more opportunity to strengthen those connections and collaborate more with primary and other physicians.
That's exactly right. I don't look at this as deterring anybody from not getting, the care that they need from their physicians. I think it's just an additional opportunity to be able to, give more information, to create more awareness. And just like you said, oral systemic health, it's really important. We're learning it more every day. So at the dental office, how can you navigate that? How can you educate your patients, making sure that that's becoming kind of a part of their care, is not just their cleaning, it's all of the other things with their, overall health of the patient.
Now, dentists are, of course, medical professionals. They're capable of providing an injection, as we've said, but they're still learning about a lot of things about the vaccine along with the rest of us. Do you have any resources you could suggest or offer that would help dentists learn more about what they need if they're going to be part of this effort?
Yeah. There's a number of resources. I mean, the CDC tends to be the greatest one source of a lot of information. For us, we've actually connected and have some consultants that have been more experts in virology and things like that. And they are really doing a great job of giving me great information about the vaccine, and then I can share it with the team. But the resources at the CDC, and then the actual links to each of the specific vaccines is readily available through the CDC site. You get all of the information and all of the frequently asked questions for what's been approved. What's pending, those are things that you'll just have to be a little bit more proactive to look for information. But what we have learned is that the vaccine is highly safe. It's very effective to what we know today. Of course, we have an organization in Europe and in England, and I got to talk to them this morning. So there's definitely concern about this new strain and what's going on with how contagious that is. So we're still learning about COVID-19 and how it's evolving. It's just rapid. Everything is happening so fast. It's a challenge to stay on top of it, but hopefully this vaccine will be able to protect us against, different mutations as well.
Okay, and do you have any other final comments about the role that dentists can play in vaccine distribution, or how it's going to impact dentistry moving forward?
Yeah, I mean, I think that the final comment is within the industry, let's continue to advocate. Let's continue to use this opportunity to be a great support to the public health effort, to this pandemic and beyond. This is just the start of, I think, creating awareness of how important dentists can be. The 100,000+ providers that we have throughout the country are a great access for patients, rural communities, otherwise. So the final comment is let's continue to use this opportunity in the profession to make ourselves aware of how to help and to be an advocate for it.
Okay, perfect. And thank you again for your time today, and good luck as North American Dental Group and your affiliated practices all take part in this massive and very important effort.
I really appreciate you having us again. We really love talking and being able to spend some time with you guys. So, thank you for yourself just continuing to help in the awareness by your publication. So really appreciate it.
Well, thanks again, and we'll definitely be in touch in the future for other emerging topics, and good luck again with the program.
All right, thank you.